Hi class, this is Professor Turpin. I'm going to run through, as promised, the review of this hypertension. And this lecture is going to talk a little bit about both hyperlipidemia or high cholesterol and also hypertension and how those two kind of go hand in hand, and look at kind of how would you really intervene with a patient and when should you intervene with a patient. This really is on slides 1 through 12 in this slide pack. I left in there items related to peripheral artery disease and some other things that you'll probably have in your next course for adult health too. But anyway, it's just a good review. You will not be tested on things in that section though, so just really primarily pay attention to slides 1 through 12 or 13. Thanks. This is just a slide that talks a little bit about the difference between arterial sclerosis and atherosclerosis. In our coronary artery disease discussion, we've been mostly talking about atherosclerosis, which is, it's a type of arterial sclerosis where the plaque forms on the inside of the arterial wall, usually due to, high cholesterol or high fat content in the bloodstream. And arterial sclerosis is a thickening or hardening of the arterial wall that is sort of a normal process that kind of comes along with aging. So just be sure when you're seeing those terms that you're clear on the differences of what those mean. Here's just some pictures. I won't go over this again, but we have talked a little bit about how that fat builds up and causes plaque. And on the picture on the right, you can kind of see the actual fat molecules and how they're kind of, edging up and creating a thicker encroachment into the flow area for the blood in the arteries. Key things that you're looking at with high cholesterol or high lipids, either meaning cholesterol or triglycerides as well. With patients that have the symptoms for atherosclerosis, you're wanting to look at their labs and see kind of what is their cholesterol, and you have high density lipoproteins or low density lipoproteins. And then they also may get labs for what's called homocysteine levels. Other things that we do for patients that are having atherosclerosis is nutrition therapy, drug therapy, smoking cessation, exercise to kind of keep the blood flowing through, and then sometimes complementary and alternative therapies are used also. Drug therapy for trying to work on atherosclerosis. These are just some examples of 3 different types of drug groups that can be used and kind of some of their action. You can see the 3-hydroxy 3-methylglutarol coenzyme A inhibitors are called statins. You've heard me say that term before, but a lot of those drugs you probably see in the hospital too. Atorvastatin is one that I've seen pretty commonly used here locally, but it has the benefit of really kind of making the adjustments in all 3 types of lipoproteins that are really good. It lowers triglycerides, raises the levels of the good cholesterol or the HDL, and then it lowers the bad LDL cholesterol also. Fibrinic acids, their main function is to really work on triglyceride levels, but they also help adjust the LDL and the HDL to optimal levels. And then another drug that is commonly used is called Zetia, and sometimes that's shown on some TV commercials here lately, but it is used kind of as a secondary line therapy, not as a primary, meaning that it might be used in combination with some other drug. And its main goal is to decrease cholesterol absorption in the small intestine. So if somebody is an overeater of cholesterol foods, then this would maybe perhaps help those not be absorbed as well. In terms of controlling blood pressure, people over 60 should have blood pressures that are below 150/90, and people that are younger than 60 should be having blood pressures that are lower than 140/90. And these findings are really based on a huge guideline. We talked about guidelines and how those are really developed, but this is a national Joint National Committee 8 that met to kind of really look at what point should patients receive drug therapy. So if you have a patient that presents to the office and they've got a blood pressure of 160/90 and they're 62 years old, the first thing you're going to want to do is check the blood pressure in both arms to make sure there's not a difference. You might wait 10 or 15 minutes and come back in the room and check the blood pressure again just to make sure that you're consistent, because once they're over that level, according to the guidelines, they need to be started on medications for their blood pressure. So sometimes people will show up at the office and have just the fear of being in a doctor's office, and they may be stressed, rushing to get to an appointment late, or different things that could impact their blood pressure being a little higher than normal. So most people will give them a chance to see if it'll come on down after a little bit of rest in the office, and then they may not have to be started on drug therapy. But that's just a good guideline. And if you have patients like this that you see for test taking purposes, make sure that you really know those guidelines and based on the age and the numbers, because you're going to be asked which ones should be treated with drugs. Essential hypertension is what we consider hypertension that is caused typically from the atherosclerosis. And it nearly always is going to result in damage to vital organs, whether that's the brain, the liver, the kidneys. So you can expect that exertional pressure being higher and higher is going to cause problems for everything downstream. And it can also cause medial hyperplasia, which is thickening of the arterioles, which are the smaller components that come off of the arteries. So if those become thick and non-responsive, then the organs that they connect to and the tissue that gets the blood flow from that is not going to get the best nutrients and oxygenation over time. Common risk factors, as we've talked about for hypertension, really are some of the same things that we have for coronary artery disease: obesity, smoking, stress, family history of hypertension, or also family history of having high lipid levels in the bloodstream, or hyperlipidemia. You also have in your text information about secondary hypertension, and you just want to be aware that hypertension can come from atherosclerosis, but it also you may get a high blood pressure reading on somebody who has severe kidney disease because they're not filtering fluids out of the body, thus raising the volume in the body and then causing high blood pressure readings. Now that's a good example of that one. But primary aldosteronism is another cause. We'll learn more about that when we get into in the endocrine system in a couple weeks. Pheochromocytoma is a tumor that grows on the adrenal gland and can create some problems as well. And so there are also, as you know, some medications that can push up your blood pressure, but you don't really have true hypertension. It's being caused by a secondary, it's secondarily being caused because of another type of disease. So I'd like y'all to look go to this link at the Mayo Clinic, and it really goes into great detail of a lot of different secondary conditions that can cause hypertension, because part of your assessment of a new client is you're looking for what is their hypertension level. You're looking at what is their disease, their obesity, their other vital signs, what lab work do they have that might show that they have hyperlipidemia as a cause. But you also want to look at what is their kidney function, because maybe the hypertension is not coming from atherosclerosis. It may be coming from a kidney problem, or it might be coming from an endocrine problem. So, when you're investigating a new person, you want to really make sure you're looking for the secondary causes as well as primary causes. And this is just another slide that talks about assessment, just what I mentioned. Again, you're wanting to look at their intake output. Do they have other symptoms of heart failure? Are they obese? What kind of stressors are they having in their life, and what bearing could that have on their blood pressure at the moment? Of course, you want to get what we call a lipid panel that looks at LDL, HDL, total cholesterol, and their triglyceride levels. And you're going to nearly always get a complete metabolic panel, because you want to look at, is there any kidney function disorders, like in your BUN and creatinine, that would indicate a kidney problem is really what's causing the hypertension instead. Of course, lifestyle modifications kind of go similar in a way to what we've talked about with heart failure. You want to encourage the person to kind of lower their sodium intake if at all possible, or use salt substitutes instead. They also need to be working on weight reduction if they're obese. They need to reduce alcohol intake, and they need to get on an exercise program. Look at different ways that they can decrease their stress levels, and also avoid smoking at all costs, because it does narrow the vessels down even further. I won't go into every single drug, but make sure that you review. A lot of these drugs are the same drugs that you're going to see for congestive heart failure, so it's not a longer list, but it is one or two extras in there, and just make sure that you're aware of those. Are all used sometimes for hypertension as well. I would ask that as a last thing that you go through and click on this slide set and work through it. It's a very, very good self-study for how are you going to treat a patient, and what kinds of teaching are you going to do for somebody with hypertension. You'll probably have test questions that come directly from this slideshow. It's self-paced, so you can kind of just click on one, look at the detail on it. It's very informative, but it gives you good ideas about which foods are appropriate or not appropriate, what kind of exercise, what kind of risk factors that somebody may have. But I think it's one of the best preps for how do you develop a plan for somebody with hypertension. Again, after this, you're just going to see quite a few different slides that come with this slide set. They are interesting to know, because I know some of you have been looking at things like peripheral artery disease. Some of you have even had patients that have had FEMPOP bypasses and things like that, and these just kind of go over some of the downstream effects when we have hypertension's effect on the lower part of the body through the arteries. So it's a good review, but you will have this content in adult health too, because these are more chronic health issues and that are very common to older patients. So don't worry about tests from this part forward, but it might be some good information for you to use from a clinical standpoint.